If you are a COTA thinking about applying to an OTA bridge program, this is the video I wish someone would have sent you before you started the process. Because the observation hours question is one that catches more bridge applicants off guard than any other thing. And the OTA who assumes their clinical hours transfer is communicating something very specific to the committee when they read their file. I've been in OT education a long time and I've read a lot of applications. Here's what observation distinction actually reveals and why it matters more than most bridge applicants realize. Here's why clinical hours are not observation hours, and I'll explain it clearly. And it's not bureaucratic, it's clinical. When you work as a COTA, you're implementing a plan. You're executing interventions, you're supporting the evaluation and the intervention process that the OTR designed. You are doing critically important clinical work. That work genuinely makes a difference. You are not observing OT practice in your role. The reasoning process that produces the plan, the evaluation interpretation, the clinical judgment, the treatment planning decisions, that process is not visible while you're in your role in an OT job. Observations are designed to reveal that role. You see the finished product. You don't necessarily see how it was built. That's what observation is for. Here's an honest picture of what working as an OTA actually shows you about OTR practice. You see the tasks, the handoffs, the disciplinary practice, you see the treatment plan, you see the goals, you may see the OTR conduct the evaluations, you may participate in that, you even may discuss treatment planning. But you see all of that inside that clinical relationship with the filter of an OTA already in place. When you observe in a setting where you are genuinely learning, watching the OTR reason fresh, without a filter of your OTA skill set, something different will happen. You see what you don't already know, and that is the observation descriptions that we want to have. The OTA who observes in their own setting sees what they already understand. The OTA who observes somewhere new sees what they need to learn. Committees can see this difference, and it's important that you understand it. Let me be specific about what observation for a bridge applicant should actually do. It should give you exposure to OTR level clinical reasoning from the outside, not the task, the thinking, the evaluation interpretation. How does the OTR decide what the assessment results actually mean? The treatment planning process. How does the clinical judgment produce intervention plans from those findings? The decision making under ambiguity. What happens when the clinical picture is unclear and a judgment call needs to be made? Those are some reasoning processes that OT school trains, and watching them happen in an unfamiliar clinical context from a genuine learning perspective generates observation evidence that gives you a stronger application. Here is the specific observation strategy that I recommend you consider as a bridge applicant. Observe in a setting that contrasts completely from your OTA practice setting. If you work in pediatrics, go to acute care, hand therapy, mental health. If you work in SNF or long-term care, go to early intervention, school-based. Outpatient rehab, maybe go to inpatient acute, NICU, home health. The reason why this works is there's a greater contrast between your OTA practice setting and your observation setting. The more genuine the learning is, the more visible the OTR reasoning process is to you, and the more compelling the observation descriptions and interview and content that you will have, because you're not seeing what you already know. You're seeing what you're training to develop. It's exactly how to ask, and here's how to exactly ask for that observation experience. Adapt this to your own voice and vibe. My name is X, and I'm a COTA practicing here, X. I'm applying to bridge programs and I'm seeking observation hours that specifically will look at occupational therapy evaluation and reasoning processes that are completely different than my own. I am not looking to shadow in a general sense. I'm specifically interested in learning how OTRs conduct evaluations, interpret clinical findings, develop their treatment plans. Would you be willing to allow me to observe 2 or 3 sessions focused specific on those components? That request communicates 3 things immediately. You understand the OTR reasoning process and what you're there to observe. You understand the difference between the 2 roles, and you are serious enough about this to have a very specific goal. So, consider this while you build your bridge application. If you want more information from me or some other pre-OT students, check out our school community, OT Student Leveled Up, or you can also go and book groups with other OT students, and you can hang out with us and get direct input from me about your application, whether you're applying as a bridge student, reapplying after a first try, whatever. We'd love to meet you. Good luck.